Diseases that give a respite from mobilization. What diseases are contraindications for service? When does a conscript get a reprieve from it, and when is he recognized as fit with restrictions? The answers to these questions are spelled out in the Regulations on Military Medical Examination, approved by the decree of the Government of the Russian Federation dated 04.07. 2013 and 565 ed. dated 29.06. 2022 in the section Schedule of Diseases. The Schedule of Diseases provides for the following categories of fitness for military service. A. Fit for military service. B. Fit for military service with minor restrictions. B. Limited fit for military service. G. Temporarily unfit for military service. D. Not fit for military service. If a disease of an organ or system of organs leads to a violation of the function of another organ or system of organs, an expert opinion on the category of fitness for military service is issued according to the relevant articles of the Schedule of Diseases. When examining citizens, in addition to the research methods given in the Schedule of Diseases, it is allowed to use more informative methods. The following abbreviations are used in the Schedule of Diseases. IND. The category of fitness for military service is determined individually. A2, B2, 3, 4 is an indicator of the purpose for military service. Schedule of Diseases. 1. Infectious and parasitic diseases. 2. Neoplasms. 3. Diseases of the blood, hematopoietic organs and individual disorders involving the immune mechanism. 4. Diseases of the endocrine system, eating disorders and metabolic disorders. 5. Mental disorders. 6. Diseases of the nervous system. 7. Diseases of the eye and its auxiliary organs. 8. Diseases of the ear and mastoid process. 9. Diseases of the circulatory system. 10. Respiratory diseases. 11. Diseases of the digestive system. 12. Diseases of the skin and subcutaneous tissue. 13. Diseases of the musculoskeletal system, connective tissue, systemic vasculitis. 14. Diseases of the genitourinary system. 15. Pregnancy, childbirth and the postpartum period. 16. Consequences of injuries, poisoning and other effects of external factors. 17. Other diseases. 9. Maxillofacial pathologies. The Schedule of Diseases has a long list of dental problems, from caries and lack of teeth to severe generalized periodontitis. But all of them, as well as diseases of the oral mucosa, salivary glands and tongue, even those that cannot be treated, stomatitis, chylitis, gingivitis, leukoplakia and others, including precanceroses, are not a reason for recognizing a person unfit for service, except that they are suitable with restrictions, including minor ones. Maxillofacial anomalies, defect, deformities, the consequences of injuries, other diseases and changes in the teeth and their supporting apparatus, diseases of the jaws with a significant violation of respiratory, olfactory, chewing, swallowing and speech functions exempt a person from service. Category D. If all these functions are expressed moderately or slightly, then he receives a category of fitness in limited use, or B. Suitable with minor restrictions. If the problem is amenable to surgical treatment, and 6 months have passed after it, then this is the reason for recognizing a person temporarily unfit for military service. Category G. If a conscript comes for examination with undamaged metal structures after osteosynthesis of fractures of the maxillary bone and, or, lower jaw with minor or no violation of the respiratory, olfactory, chewing, swallowing and speech functions, he is recognized as fit for service. A. Or fit with minor restrictions. B. 10. Diseases of the digestive organs. Peptic ulcer of the stomach, duodenum, diseases of the esophagus, intestines, peritoneum, liver, gallbladder, biliary tract and pancreas, even in remission, can be both the reason for the verdict unfit and fit with restrictions. The verdict is determined by the peculiarities of the course of the disease, the degree of manifestation of digestive disorders and diagnoses named in the Schedule of Diseases. If the detected diseases of the esophagus do not affect the digestive process and do not manifest themselves in any way, they allow you to get the shelf life category A, without restrictions, and B, with minor restrictions. We are talking about such diagnoses as reflux esophagitis, i.e. severity with rare relapses, reflux esophagitis I severity. The same categories of fitness for service can be established for people with chronic gastritis, gastroduodenitis with a slight violation of secretory function with rare exacerbations, biliary dyskinesia, fermentopathic, benign, hyperbilirubinemia, chronic cholecystitis, gallbladder cholesterol, pancreatitis with rare exacerbations with good treatment results. As for chronic hepatitis, if there is no violation of liver function with the established diagnosis and/or their manifestations are minimal when conscripted for military service, military training, soldiers, sailors, sergeants, and petty officers, according to the results of the examination, receive Category B, limited fit, and officers and ensigns, midshipmen, A, fit and B, suitable with minor restrictions. Hernias can become the basis for obtaining categories D and B if they are poorly treatable or relapse, if there are contraindications for treatment or a person refuses it. These are large or poorly located hernias that affect the work of internal organs, diaphragmatic, unrecoverable ventral, recurrent. Small, within the physiological ring, umbilical hernias, properitoneal lipomas, as well as the expansion of the inguinal rings without hernial protrusion during physical exertion and straining do not prevent military service. Temporary disorders of the digestive system after an acute illness, exacerbation of a chronic disease or surgical treatment give the right to receive a postponement, the shelf life category of 11. Skin diseases. Those suffering from difficult to treat common forms of chronic eczema, psoriasis, atopic dermatitis, with bullous dermatitis, all types of pemphigoid, bullous pemphigoid, herpetiform dermatitis of During, are recognized as unfit for service. According to the results of the examination, 3 categories are prepared for conscripts C, B, A in the following skin diseases: chronic urticaria, recurrent quincedema, widespread and limited psoriasis, abscessing and chronic ulcerative pyoderma, multiple conglobate acne, atopic dermatitis with focal lichenification of the skin, cutaneous forms of lupus erythematosus, polymorphic photodermatosis, common and often or rarely recurrent lichen planus, common and limited eczema, limited often or rarely recurrent eczema, often recurrent multiform exudative erythema, chronic course of the cutaneous form of hemorrhagic vasculitis, gangrenous pyoderma, abscessing and undermining folliculitis and perifolliculitis of the head, scleroderma, ichthyosis, congenital keratoderma, common and total forms of nestalopecia and vitiligo, xeroderma, follicular keratosis. Separately, the schedule of diseases states that the presence of atopic dermatitis, exudative diathesis, childhood eczema, neurodermatitis in the medical history in the absence of a relapse over the past 5 years, as well as a type of limited scleroderma, white spot disease is not a reason for restrictions on service or for its passage in principle. A postponement is issued if functional disorders temporarily persist after a recent acute illness, exacerbation of a chronic skin and subcutaneous tissue disease. 12. Diseases of the musculoskeletal system, connective tissue, systemic vasculitis, arthritis and arthropathies of infectious, inflammatory and autoimmune origin. Rheumatoid arthritis, seronegative spondyloarthritis, ankylosing spondyloarthritis, Bechtereau's disease, chronic course of reactive arthritis, psoriatic arthropathy, diffuse connective tissue diseases, systemic vasculitis, giant cell arthritis, polyarthritis nodosa, Kawasaki disease, Wegener's granulomatosis, microscopic polyangiitis, eosinophilic angiitis, etc. Systemic connective tissue diseases, even with moderate functional impairment, can cause the establishment of Category D. Minor functional disorders and rare exacerbations of the disease are a chance to receive Category B, that is, suitable with restrictions. Chronic forms of reactive arthritis in the absence of an exacerbation of the disease for more than 5 years and without impaired joint function do not interfere with military service in any way. The conclusion on the category of fitness for military service in diseases of bones and joints is made after examination and, if necessary, treatment. This takes into account the tendency of the disease to relapse or progression, the persistence of recovery and the peculiarities of military service. In case of unsuccessful results of treatment or refusal of it, the decision is made depending on the function of the arm, leg or joint. If it is severely violated, the person is declared unfit for service. A moderate violation allows you to serve with the category limited fit. A minor functional impairment or its absence with an established diagnosis is category B, and for officers even A. Those who have suffered acute inflammatory diseases of the joints are recognized as temporarily unfit for military service for 6 months after the end of treatment. 13. Diseases of the spine. Degenerative, dystrophic and inflammatory diseases of the spine, congenital and acquired deformities, malformations of the spine with a significant violation of protective, static and motor functions are exempt from military service. Moderate and minor violation is the reason for obtaining the category of validity in. At the same time, a moderate violation is considered to be the inability to maintain the vertical position of the trunk for more than 1-2 hours, moderate local tension and soreness of the long muscles of the back, smoothness of cervical and lumbar lordosis, the presence of degenerative scoliosis of the IE degree, segmental hypermobility of the spine, limitation of the amplitude of movements from 20 to 50% in the cervical end, or thoracic and lumbar spine, weakness of the muscles of the extremities, their rapid fatigue, paresis of individual muscle groups without compensation for their functions. A minor degree of spinal dysfunction is characterized by clinical manifestations of static disorders that occur after 5-6 hours of being in an upright position, limiting the amplitude of movements in the spine in the cervical end, or thoracic and lumbar spine to 20%. Motor and sensory disorders manifested by incomplete loss of sensitivity in the area of one neuromotor, loss or reduction of tendon reflex, a decrease in the muscular strength of individual muscles of the arm or leg. As for scoliosis, one of the most common problems with the spine, a fixed scoliosis of the 2 degree with an angle of curvature of the spine of 11-17 degrees without functional impairment allows you to get a category of fitness B, fit with minor restrictions.